Hello and welcome to this special program. Now, it's important to live a balanced life, and our health and well-being play an important role in this. Every day we're warned about several devastating diseases. Perhaps one of the deadliest among them is heart disease. Heart disease is the #1 cause of death in men and women worldwide. More people die from it each year than all forms of cancer combined. Heart disease doesn't only occur in older adults, it's now affecting younger people more and more. What is more threatening? Heart disease can cause death instantly, and the main reason for heart-related deaths is lack of awareness about what to do in a cardiac emergency. Educating the public about the signs of a heart attack and cardiac arrest and the importance of taking immediate action to improve survival can minimize some of that damage that occurs during a heart attack or a cardiac arrest. Now, a cardiac arrest can occur without warning in people who appear to be healthy and have no known heart disease or other risk factors. Most cases of sudden cardiac arrest usually occur outside of hospitals and in homes or in the public spheres. We can reduce the mortality rate through awareness and bystander intervention with life-saving techniques like cardiopulmonary resuscitation. Save a Life tries to make people aware of the early symptoms and signs of cardiac arrest so patients can get to hospital on time and even be given resuscitation if the need arises. As always, we're joined by medical experts to take us through just what to do in situations like this. Dr. Deepesh Agarwal, professor and consultant interventional cardiologist with the Mahatma Gandhi Medical College of Jaipur, is with us. Dr. Hammad Salim Momin, consultant interventional cardiologist with the Hindu Sabha Hospital, Shushrut Hospital in Mumbai, is with us. Dr. Hitendra Bhagwatkar, head of the Department of Cardiology at the Lata Mangeshkar Hospital in Nagpur, is also with us. Thank you all, gentlemen, for joining us on this show. Dr. Agarwal, let me begin by asking you, the higher one's blood pressure levels, the more risk for heart problems is what we generally know. How, though, is blood pressure exactly related to heart disease? Dr. Deepesh Agarwal?
Yeah, hi, good afternoon. So the very important, as you said, that the risk factor for sudden cardiac arrest are many, and lifestyle modification is important to reduce the risk. So if you talk about the blood pressure, so we should know the normal level of blood pressure first. So it is around 120 to 80 is the normal blood pressure, but whenever it goes above 140 and 90 millimeter mercury, it causes more of vascular events. And if you see that ill effect of the higher blood pressure, if you persistently remain high, then the chances of having a stroke, having heart failure and kidney diseases are more. So persistently high blood pressure is a more risk factor for having a stroke, that is paralysis. Then the more is chances of having heart failure, that means breathlessness and swelling in the leg. And then it also affects the kidneys. So in long term, you may have a kidney failure. Apart from that, peripheral vascular disease like pain while walking is important for blood pressure management. And then retinopathy is important complication of high blood pressure. So those who are having persistently high blood pressure, they are having a risk of development of vision impairment, that is retinopathy. And the deadliest one is aneurysm of aorta. So high blood pressure causes sac formation of your aorta, and that causes pain in abdomen, and if it ruptures, then may cause sudden cardiac arrest. So these are few important complications of persistently high blood pressure that a person can have. So we should keep our blood pressure in check.
Right. Dr. Momin, clogged arteries can lead to heart attacks and strokes, but can high blood pressure indicate that blocked arteries are happening? Is there a direct correlation, Dr. Momin?
A very nice question. Clogging or the blocking of the coronary arteries, that is the arteries which supplies blood to the heart, can lead to heart attack, which is termed as myocardial infarction, which means the necrosis of the muscles of the heart. And in the same way, the clogging or the blockage of internal carotid arteries or the arteries which supplies blood to the brain can lead to stroke. Arteries have its role in controlling blood pressure, and in the same way blood pressure can affect arteries too. High blood pressure can damage the inner layer of the arteries, and fats can accumulate in these inner layers, leading to atherosclerosis and clogging of the arteries. So yes, high blood pressure can indicate blocked arteries in most of the cases.
Right. Dr. Bhagwatkar, how long can you have high blood pressure before it can actually cause damage to your heart? And, are there preventive measures?
Yeah, blood pressures actually it varies from person to person. Many of the persons they are having high blood pressure and it is unnoticed for a long time. They don't have any complaints, they don't have any symptoms. Uh, but in some persons, because of the high blood pressure, they can manifest it at a very acute stage with headache, with loss of consciousness, and they can also manifest it with the heart attack and the kidney damage also. So the high blood pressure it has a devastating effect on the body, on the heart, on the brain. It can lead to paralysis also, but the manifestations is different for different people are there. So it is very much important to get the blood pressure checked up regular basis from a family doctor or from a physician or a cardiologist.
Right. Let's also bring in Dr. Agarwal again. Dr. Agarwal, can a sudden spike in blood pressure cause a heart attack? And what kind of blood pressure really triggers a heart attack?
Yeah, so if you talk about blood pressure and risk of the heart attack, so there is no limit actually which tell you about that at this level you may have a heart attack. But yes, if sudden spike occur at any point of time, that may cause called myocardial ischemia as heart attack as well. But if you talk about the level, at what level person may have, it is very difficult to say, as the blood pressure level at any level patient may have heart attack. Like if a person is having blood pressure of 110, 120 or even less, the patient may have heart attack, because the reason for heart attack is choked coronary arteries. But again, that can be precipitated by anybody which require higher blood pressure or having higher blood pressure, that may also lead to heart attack. So if a person is having MI, person may have low blood pressure, person may have normal blood pressure, or even patient may have higher blood pressure. So the blood pressure level per se doesn't indicate at this level person may have MI. But yes, if sudden spike occur, patient may develop MI, or more common is stroke, and heart failure is the important complication of sudden rise of blood pressure, probably.
Right. Dr. Momin, then what is the importance of home blood pressure monitoring for people who have existing cardiac conditions? Are these blood pressure monitoring devices that we use at home entirely accurate? Can they be trusted?
Yeah, it is a very important question. Home blood pressure monitoring device is a self-monitoring tool, and it is recommended by major guidelines on hypertension. It helps in predicting cardiovascular mortality and morbidity better than office BP. Office BP is when the BP is checked in a clinical setting or a hospital setting. Then it helps in diagnosing various conditions like mass hypertension, white coat hypertension. It also helps in managing patients such as changing the doses or adjusting the medications. Along with that, coming to the second part of your question, the accuracy of home blood pressure monitoring device varies depending upon which device is used and how it is used. Right. Digital oscillometric devices are the preferred ones. Validated devices must be used. Patients should be at rest for at least 5 minutes prior to checking of blood pressure. Blood pressure should be checked in sitting position with feet on the floor and the backrest. Supine position is the preferred position. Caffeine containing drinks or the smoking at least 30 minutes prior to checking of blood pressure must be avoided. So yes, home blood pressure monitoring devices are mostly accurate when validated devices are used in a recommended fashion. Thank you.
Thank you so much for that answer. Very clear one, if I may add. Dr. Bhagwatkar, what happens if you have an abnormal heart rhythm, and what is the most common serious heart rhythm abnormality?
Yeah. So most of the people can have abnormal heart rhythm, and usually it is the patient will be complaining of having palpitation, or the sensation of that they can feel their heartbeat. So the heartbeat can be faster also, and it can be slower also. If the heartbeat is faster, then the most common the condition of the heart, it is called as atrial fibrillation, where the heart it palpates at a very fast rate of 200 to 300 per minute, and it can also have another it is tachycardia conditions called as ventricular tachycardia and ventricular fibrillation. Usually ventricular tachycardia, ventricular fibrillation, it is life threatening, and it can cause sudden cardiac arrest and in which the heart stops. So recognizing these conditions or diagnosing this condition is very much important. Atrial fibrillation is the most common cause of the tachycardia, which is found in most of the common public populations. And atrial fibrillations usually have can cause complications like it can dislodge any clot from your heart and it goes to the brain, and the patient may land with paralysis. Fast heart rate can also cause heart attack, and it can cause heart failure also. And the clots can go in different parts of the body and can cause different manifestation, and life-threatening complications are there. Out of this, ventricular fibrillation and ventricular tachycardia is life-threatening arrhythmias, and that need to be addressed as soon as possible, and the treatment should be started very fast in such conditions.
Right. Doctor, well, thank you very much indeed for all of those answers. We will take a quick break at this point, but there's lots more to talk about. We'll be back in just a moment. Welcome back to Health and Wellness Save a Life. We've been talking about heart health and the connection between high blood pressure and the increased risk of cardiac arrest, the importance of blood pressure monitoring, and much, much more. Dr. Agarwal, if I can come back to you, we've just discussed how an abnormal heart rhythm can be dangerous, but which abnormal heart rhythm can cause sudden cardiac arrest and how? If you could just expand on that for us.
So it was previously already said that the ventricular tachycardia, probably high ventricular rate and ventricular fibrillation is basically a most common life-threatening arrhythmia which common public faces. So our normal heart rate is around 100. So ventricular usually beat at rate of 60 to 80, but up to 100 there is a chances of less cardiac arrest. But if ventricle, that is lower ventricle, beat faster than the 100, and that is incoherent to the atrium, upper chamber of the heart, so that can cause sudden cardiac arrest. The reason is probably heart itself need enough time to fill with the blood from our body. But if heart rate is very high, like in ventricular tachycardia, so it doesn't get enough blood inside heart so that it can pump it out to other body organs. So one is ventricular tachycardia, another one is ventricular fibrillation, when ventricle is contracting incoherently. So there is no contraction, effective contraction from the ventricle so that the blood can come out from the heart. So that is again is a life-threatening condition. So these two are very important life-threatening condition. Apart from that, if person is having a very low heart rate, like in complete AV block or heart block, where the person's heart rate is say 5, 10 or 15, in that case, the blood is probably not going out of the heart to brain and other body organ, so that can be other reason for cardiac arrest. So in the most of the patient, though out of hospital death, even in hospital death, sudden cardiac arrest, the reason almost in all is ventricular tachycardia and ventricular fibrillation. So erratic contraction of the ventricle is important cause for sudden cardiac arrest or rhythmic arrest of the heart. So yes, this is important.
Dr. Momin, if not treated immediately, sudden cardiac arrest can lead to death, but how can CPR help in situations where there's been sudden cardiac arrest? Dr. Momin?
This one is an important question, especially for the public level. Sudden cardiac arrest is an abrupt cessation of mechanical function of the heart, that is abrupt cessation of the beating of the heart, which eventually leads to death if not intervened immediately. 9 out of 10 out of hospital sudden cardiac arrest patients often die, and CPR is a first aid tool reviving from patients from sudden cardiac arrest. So CPR stands for cardiopulmonary resuscitation. And in CPR we give chest compressions along with the mechanical artificial ventilation to preserve the intact brain function, like inhibiting the brain death, along with that maintaining the other vital organs. If CPR is done timely, immediately, it increases the chances of reviving the patient from sudden cardiac arrest by 2 to 3 times. Many hospitals and medical institutions, societies conduct various CPR training programs. I recommend such kind of programs should be encouraged at a community level. It is a need for an hour. Thank you.
Right. Dr. Bhagwatkar, how important is it that people whose relatives in particular suffer from heart disease learn how to give effective CPR?
Yeah, CPR training is very, very much important. Usually the people with the heart diseases or heart problems who has prior history of heart attack or who has undergone some heart procedure like angioplasty and some bypass surgery, such patients with the heart disease are very at a very high risk chances to go for cardiac arrest or sudden cardiac death. So CPR training is very important because if the relatives know how to give a proper and good CPR, and the patient and the goes into the cardiac arrest, it can save the patient life. So a good and proper efficient CPR is very important because in cardiac arrest, the patient heart stops, and after giving CPR, the patient can be revived back, and we get the time for the patient to reach the hospital, and then the other medicines and other treatment can be started. So definitely, CPR training is very much important, and CPR is life saving for the patient.
Right. Dr. Agarwal, can a healthy lifestyle such as regular exercise, nutritious diet actually help to reverse heart disease or to reduce the risk of developing heart disease?
Yeah, so healthy lifestyle is always recommended and we should all follow healthy lifestyle. Now the question comes, what are the important parameters for the healthy lifestyle modification? So as you already said, the physical exercise or physical activity is very important point. Nowadays we are seeing sedentary lifestyle, especially in young kids and young generation. They are doing work at home. Diet is important factor because having a good fiber diet is very important. Taking less fibro-fatty foods, especially fat content or carbohydrate content, they are very dangerous to our health. Then sleep is very important factor. Those who are doing night shift duties, they are at risk for development of cardiac illness, especially atherosclerosis. Smoking, alcohol intake, smoking is very dangerous. That causes sudden block and clot in the arteries, and that can be a reason for sudden cardiac arrest and myocardial infarction, heart attack, and arrhythmias. Now, for exercise, if you say around 150 to 160 minutes per week of walk, brisk walk, that is 30 to 40 minutes per day, is important. And if you follow these norms, then definitely you can reduce your cardiovascular events that can happen in next time. Now, apart from that, in dietary habit, if you say the salt intake, because we are talking about blood pressure and hypertension, salt is very important factor that can increase blood pressure. So limiting salt intake in any form is very important. If you can reduce salt intake to less than 5 gram or 8 gram per day, then you can reduce your blood pressure in tune of 5 to 8 millimeter of mercury. So the lifestyle modification, dietary modification, proper sleep, and having a less stressful life, that can definitely reverse or reduce cardiac ailment, especially blood pressure, risk of heart attack, and risk of heart failure and stroke as well.
Right. Dr. Momin, it's already come up in our earlier discussion, smoking, one of the major risk factors for heart disease. If a person who is a long-term smoker stops smoking, can the risk of heart attacks actually reduce?
Yes, smoking is one of the major risk factors for cardiovascular disease, like leading to heart attacks, stroke, peripheral arterial disease. And there are many studies which have shown that smoking cessation helps in reversing this risk of having heart attacks. Like in one of the studies, it has been seen that even within 1 week of stopping of smoking, excessive platelet aggregation, that is the excessive clotting tendency of a blood, decreases just within 1 week of stopping of smoking. Then in another study which was conducted in the patients of almost 50 years of age having a heart attack, and if they have stopped smoking and the follow-up was for 1 year, so they have seen that almost 70% of these patients who have stopped smoking had reduced risk of having another heart attack or death as compared to the patients who have continued smoking. So yeah, definitely smoking is one of the major risk factors, and cessation of smoking helps in reversing all this risk, and especially among the young individuals, smoking is one of the major risk factors. So it should be, smoking cessation should be encouraged at a community level, Even in schools, colleges, the students and the young generation should be make aware of the deleterious effects of smoking.
Right.
So yes, cessation of smoking reverses the
Okay. Well,
chances.
good to know that. Dr. Bhagwatkar, we've talked about blood pressure at length and its connection with heart disease, but, tell us about systolic and diastolic blood pressure and, what is more important? How do we sort of, when we monitor, what is it that we need to look out for?
Yeah. So systolic and diastolic blood pressure. Systolic blood pressure is the upper number in your blood pressure reading, and diastolic blood pressure is the bottom number in your blood pressure reading. Whenever you take the blood pressure, you can see the two numbers. The upper is the systolic and the bottom one is the diastolic blood pressure. Both parameters are important. Systolic blood pressure is the pressure inside the arteries when your heart beats, and diastolic blood pressure is the pressure inside the arteries when your heart relaxes. That is in between the two heartbeats, where there is a relaxation phase, and the pressure inside the arteries is the diastolic blood pressure. So systolic blood pressure and diastolic blood pressure both have complications if they are above their upper limit is there. Systolic blood pressure can cause heart attack, can cause heart failure, and can cause damage to the other organs also. Diastolic blood pressure usually cause high pressures in the aorta or the arteries, which are peripheral arteries, and it can cause the various aortic diseases. So control of the systolic and diastolic blood pressure is very much important by getting it checked by your family doctor or family physicians, and starting the adequate medications is very much important, or as we have discussed previously, by following a very good healthy lifestyles.
Right.
Thank you.
All right. Thank you so much, all of you, for that very detailed conversation about blood pressure and cardiac arrests. We hope this has been useful for all viewers tuning in. Thank you very much indeed.